Now, next up, we'll hear from colleagues from the Popcorn platform who are sharing inclusive research and diverse community engagement perspectives and considerations. Children's Healthcare proudly supports the Popcorn Initiative through our Spark Impact program. And this deliverable, this session is actually a deliverable through that project. I'll just take a moment to briefly introduce our Popcorn speakers. You can check out their full bios on the event page on our website. Ananya Banerjee is an assistant professor and lead of the Equity, Diversity, Inclusion, and Anti-Racism Standing Committee in the School of Population and Global Health at McGill University. Patricia is associate professor and pediatrician and researcher at Montreal Children's Hospital and the Research Institute of the McGill University Health Center. Vivian Qiang is a project manager at O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health. Marianne Sarufim is a Master's of Public Health student at McGill University. Shazeen Suleiman is a clinical associate professor, general pediatrician, and researcher at Stanford University. And Josh Swain is a policy development officer in Indigenous health at Toronto Public Health. Over to you, Ananya.
Thank you so much, Paula, and thank you to the audience for joining us today. We're hoping to engage in an impactful dialogue among all of us. Today we'll be talking about, as it was highlighted, on providing perspectives and considerations when attempting to do inclusive research with diverse communities. Next slide, please. I would like to share a land acknowledgement as an invitation to inquiry and to reflect how we deepen our relationship when we hear a land acknowledgement. We are all, as a team, joining across North America from the East to the West Coast that reflects the diverse First Nations, Inuit, and Métis peoples whose presence continues to mark this territory on which our team gathers today. This includes Qiang, Montreal, that includes the Haudenosaunee and Anishinaabe Nations, Takaronto, traditional territory of the Mississaugas of the Credit, the Anishinaabe and the Chippewa, the Haudenosaunee, and the Wendat people. It is also the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Many of us are settlers and whose ancestors have been impacted by British and French colonialism. We need to all be socially conscious that as settlers and understand that we continue to be beneficiaries of Canada's policies that continue to discriminate against Indigenous communities. We must commit to truth and reconciliation and the 52 calls for action and work. And how is this embedded in our research? It is important that we fight with Indigenous communities to affirm their inherent rights. For us to hear a land acknowledgement is a reminder and a continuous wake-up call for all of us where and how we can learn more about colonial oppression, the dispossession of land to the residential system, the 60 scoop, and other deconstructive government policies. We must walk forward together towards a future where Indigenous human rights, including the right to self-determination, languages, cultures, and traditions and laws, are recognized, valued, respected, but most importantly, celebrated and honored in academia. We also like to acknowledge the many people of African descent who are not settlers, but whose ancestors were forcibly displaced as part of the transatlantic slave trade, brought against their will and made to work on these lands. We must recognize advancing Indigenous sovereignty is deeply and intrinsically linked to Black liberation, and we must remain committed to advancing both. Next slide, please. I'm excited to introduce a team, which is a family like to me. We have been working for years together. We are all part of different trajectories of our academic careers, many who are our former students and now are our colleagues. Relationships that have been created among our team that has been very organic, and the opportunity to really highlight that we are not experts, but co-learners engaged in community. All that we offer you today is the knowledge that has been shared with us from various communities that we have relentlessly worked with, impacted by systemic marginalization, and also based on our lived experience. It's important that as a team, we fully acknowledge our power and privilege we hold as being part of Eurocentric academic institutions that continue to uphold white supremacy, and really here with permission from the communities that we work with to bring our collective voices as allies and co-conspirators. We are also here to learn from all of you in the audience as well. Next slide. So our objectives are outlined here. I think what's really important to understand that this is complex, it's nuanced, and also our presentation builds on the exceptional presentation that has just been given by Dr. Bukola Salami. In no means you will leave with full solutions and have the best practices, as we are all grappling on how to do community-based work or led research or engaged research or participatory research, but really understanding that our work is ultimately rooted in not just social justice, but research justice and principles, and understanding that our work ultimately benefits the communities who continue to be impacted by historic, sociopolitical, and colonial marginalization that truly leads to radical and transformative changes in our systems of oppression, using that intersectional lens that really push and achieve for child health equity. As I said, it is complex and messy, and we'll be working through that together and understanding that for all of us, it is a constant self-reflection and, most importantly, decentering our experiences as academics. Next slide. So we're going to begin with a brief background, the call for EDI. We cannot deny that we are all part of healthcare institutions and research organizations and funders that have made clear commitments and developed agendas to address diversity, equity, inclusion, anti-racism, often that are seen as buzzwords and words that have resurfaced from 2020 as a result of the needless death of George Floyd, and also the pandemic that demonstrated clearly that viruses are not an equalizer. And so in the recent years, we have been called to proliferate the language, predominantly by tri-council agencies, such as the Canadian Institute of Health Research, that has a strong motivation to have funding to study racialized communities and other marginalized communities based on their sex, gender, and sexuality, migration status, and so forth. And to understand health patterns and lived experiences, though understanding this work has been being done for decades, or if not centuries, spearheaded by Indigenous communities. All of us as researchers at our all career stages have responded to these calls. And unfortunately, they have, and that includes many of us, minimal or no training in health equity or lived experience with marginal identities. My students in public health and epidemiology are still struggling and calling for a curriculum that truly centers equity, and we are failing our students consistently. Despite even for us who have lived experiences with marginal identities, I think what's really important is to question and inform ethical research processes and understanding what is high quality research that truly benefits the health and well-being of marginalized communities that are driven by our systems. As researchers, we are actually uncritically using existing data to research health inequalities and parachute into racialized communities as saviors to conduct research. And what is essentially happening from these increased calls on EDI is that it is essentially boosting our research productivity, but is actually doing very little to address health inequities. And so this leads us to understanding this phenomena that I am explaining to all of you is health equity tourism, which is defined as investigators without any prior knowledge on health equity launching research programs in the last 3 years on, rather with, vulnerable groups. This is not only inclusive of white scholars, though they represent a high proportion, but it also includes us who are racialized, who strive to approximate to whiteness and are trained by our Eurocentric institutions to just produce and produce and produce. Research that we are producing as academics, the reality is it's disregarding the scientific inquiry that has caused real harm to racialized communities. We can't forget about the Tuskegee study. We can't forget about medical experimentation on Indigenous lands here in Canada. And we're also reproducing redundant findings that continue to represent the health needs of marginalized populations that are pathologizing, take a deficit lens. And essentially, as Dr. Nicole Red-Rivers, Indigenous scholar, says, we are producing battered data. This cumulative result is a reinforcing cycle of scientific exploitation and continued mistrust between academic and racialized communities, which serves to exacerbate rather than improve health inequities. Communities are being left who have told us over and over again, what happened to our data? What were the conclusions drawn from it? How do we own it? And what are the policy changes that are being advocated as a result? They're tired of just seeing publications and renewed calls for grants. It is important for us as academics to recognize that community members are the experts of their own experiences and that communities should govern scientific inquiry. And so Indigenous and Black communities have been at the forefront to combat parachute science due to historically harmful research practices that result in mistrust of academic teams and institutions that we are all part of. And we really need to unpack the large and complex inequities in health determinants, health status, and outcomes, and the complex research experience with health systems and care providers. I'm happy to now pass the baton on to my colleague, Josh Swain.
Thank you, Ananya. Every time I hear Ananya speak, it just reaffirms my commitment to doing this work. Thank you so much for such a good opening. So we want to start this off with a little bit of a group discussion here on meaningful engagement. And what we'll be doing is a bit of a mentee sort of participation. So I have put that number in the chat. It will be on the coming slides as well if you'd like to use the QR code. So a bit of a small case study. You're working on a federally funded research project focused on enhancing care and support for transgender youth. The project involves hosting a series of engagement sessions across Canada with healthcare and social service providers and organizations. Today is your first session, and after providing a brief introduction, you open the floor to discussion. A trans youth activist stands up to protest. They express disappointment and hurt at what they feel is a glaring lack of trans youth representation on your research team, and says that they're tired of attending engagement sessions facilitated by outsiders without seeing concrete action in their community. So a couple things to keep in mind as we move forward. What are the issues here? What could we have done to prevent the situation? And how do you move forward with humility? What happens now? So if you want to join the Menti here, either using the code provided or the QR code, I'd just like to get your opinions on what steps could you or your team have taken to prevent this situation. So give it some thought. It doesn't have to be overly wordy. Again, as Ananya said, we're all learning together here. We're not hoping to have all of the right answers, but just some thoughts that you might have. I'm just seeing answers starting to come up here, and you'll be able to see them on your screens as well. So I'm seeing engage trans community from the start. The QR code is just blocking that one, sorry. And then consultations with individuals with lived experience as you build your research plan. That's exactly it. And we're going to get more into that as we go through. That's super critical from the beginning of the actual research planning process. Hiring trans youth as partners and pay them well from initial study planning, exactly. And we talk about this a lot, the importance of honorariums, actually honoring people's time commitments as well as their lived experience. Engaging members of the community from the envisioning of the research, exactly. Engage people with lived experience. And then, Patty, I'm wondering if we are able to scroll down just to continue seeing. There we go. I just want to get that one by the QR code. Research questions. Oh yeah, maybe we could even close the QR code now that everybody's perfect. Yeah, so research questions ideally should be generated by the community, exactly. And that's something that Ananya just touched on. When forming the research team, working on the project, inclusive of trans community members as part of the teams, exactly. partnering with trans use. These are all exactly the types of answers that we're looking to see in some of the topics that we're going to be covering. Engage people with lived experience, exactly. I'm seeing a lot of the same themes here, and this is really great to see. So I'm wondering, Patty, if we want to move on to so what are some possible steps moving forward? And again, this is one where we aren't looking for anyone to have the answers, but what are some thoughts that you might have, or that, from your experience and research that you might want to contribute to this? And again, the real crux of this was that the trans activist was just expressing disappointment and hurt that they felt a lack of representation, and that they were tired of attending engagement sessions facilitated by people, that aren't part of the community with lived experience, and that they want to see concrete action for their community. Patty, maybe if we could maybe just slide the QR code up just in case people do still need it. Oh, maybe it's not movable yet. Maybe we can keep it up for a second longer. Yeah, people can also join using the code above. Oh, sorry, there we go. So reach out to community now and ask them to be involved in steps, exactly. Yeah, apologizing and owning the mistake, I think that's a really important one. We're all, we need to be vulnerable, especially as researchers, and humble as researchers. And there's nothing wrong with making mistakes. It's how you actually respond to those mistakes that you make and how you own them, how you make sure that you right the wrongs, because we've all been guilty of it and we're all going to be guilty of it in the future as well. Continuous advocacy towards involving communities in research, exactly. We should have done that. And yeah, exactly. And again, just like a simple apology goes a long way, an acknowledgement of why they're feeling the way they are, especially as a community that you're hoping to engage with in your research project. Important to sincerely apologize. I'd really love that we're seeing a lot of the same themes on both of these slides. Yeah, validate their feelings, exactly. And as someone, myself, is not a trans person, but someone that belongs to the LGBT community, that is something that I've thought about, in my own life as well. And I think that just that acknowledgement means a lot to me if there's ever been sort of the same situation that I've come across. Yeah, exactly. A simple, open, and honest conversation, active listening, exactly. I think that one is really important too, because in these cases, it's important to hear them, listen, but also hear. These are great. Well, thank you everyone for participating. And as we move into my next coming slides, I wanted to ask, and this can just be a really quick one, some words that come to mind when you think of community, because what we're really going to do in the next few slides is go over, yes, again, yes, Ananya, thank you so much for participating, everybody. Yeah, just a few words that come to mind when we think of community. We won't spend too much time on this one in the interest of time, but even just a few words we could get. All right, so let's see, the word cloud is starting here. So, yep, safety, similar characteristics, relationships. We're seeing safety really kind of centered here. Comfort, yes, bonds, absolutely, relationships similar. Again, safety and belonging really taking the center here. Excellent. All right, yeah, I think we can move along, Patty, because it sounds like, yeah, we've really kind of got our words centered on safety and belonging, which I love. Commonality, absolutely. So what I really wanted to speak about was just how we define community in inclusive research. And, community can mean so many different things. It's more than just a geographical location. It really encompasses a group of people who have shared common backgrounds, experiences, hopes for the future, so much more. And communities really provide a sense of belonging, support, and really importantly, shared identity. We use that word a lot, shared experience, lived experience, but it does really form part of your identity. And inclusive research involves, as we've said, and a lot of people picked up on those Menti questions, actively engaging diverse communities to ensure that their voices are heard, and importantly, respected. Communities really often have extremely unique experiences. They have unique cultures, and they might share that perspectives. And these all help to enrich research outcomes. And I think this is really especially important to remember when we're considering the inclusion of Indigenous peoples in your research. I've included a map here with just some of the larger population centers in Canada and just showing how they overlap. And it's really important to remember, and I'm going to cover this on my later slide, but there are hundreds of First Nations, Inuit, and Métis communities across Canada, and they each have their own identity, culture, they have their own experience, and one's experience really doesn't represent another. So just kind of keep this map in mind as we move forward. So how should we think about inclusivity? Again, as I've put here, who gets a seat at the table? And there are some things that I've put into this, and this doesn't encompass everything, but these are some of the main ones that come to mind for me. Diverse representation, ensuring that the community being engaged is diverse and representative of different backgrounds. That can include race, ethnicity, gender, age, socioeconomic status, ability. And then accessibility, making sure that the community members can actually participate fully in the research process by providing them accommodations they might need, offering materials in different languages. I think this is becoming more and more acceptable as the norm, which I really appreciate, especially Indigenous languages. If we're going to be doing in-person sort of engagement sessions, providing transportation services, physical accessibility for people with disabilities. And then cultural sensitivity, respecting the cultural differences of people that are going to come to the table and being sensitive of that community's needs, including their customs, traditions, values. And I think really importantly, avoiding kind of imposing your own cultural norms and being open to learning from diverse perspectives. Equitable participation, providing opportunities for community members to contribute to the research process and ensuring that there's power dynamics are balanced, because that's something, especially in research, that has been historically such an issue. There is such a power imbalance. And as Ananya said, doing research on and not with or for people is a really big issue. So we need to really make sure that we're having those voices not just heard, but kind of like actively being supported. And then, transparent communication. This is really big as well. Make sure that you're communicating your research goals, what the methods are going to be, the outcomes, in a way that's going to be accessible to all participants. Using language and formats that are easy to understand for everybody, not just for those that are in academia. Collaborative decision-making, involving community members in the decision-making process related to the research, and respecting the community expertise. As Ananya said, those with lived experience are the ones that know best. And I think really importantly, also including local knowledge in the research project. Building capacity, again, this is another one of those buzzwords, but what does it really mean? What we're trying to do is empower community members to actively participate in the research. And that means providing training, resources, and support to them as needed so that they are able to contribute to the research, fostering skills and leadership opportunities within the communities that you're working with. There's always going to be ethical considerations, making sure that that people are providing informed consent, understanding privacy, that confidentiality, and data ownership and sovereignty. And this has to be all throughout the research process. Long-term engagement, building and maintaining trust, and trusting relationships with the community that you're doing research with, just beyond the immediate scope of the research project, but fostering ongoing collaborative and sort of like mutual support. And then, getting feedback and reflection. We want to solicit feedback from the community members that we're working with on this research project. Outcomes. What does success look like as part of that evaluation? Because they're the ones that are going to tell you at the end of this what success is going to mean. And I think, yeah, next slide. So again, this is one thing to really consider, just some insights from the Canadian Indigenous population. And again, as I said before, they're extremely diverse and they comprise individuals with varying traditions, experiences with the research or healthcare system, and also different experience with willingness to participate based on those experiences. Indigenous communities are also really rich in diversity. Like you said, the First Nations, Métis, and Inuit people already are three groups, but within that, there's so much diversity within each of those. And then I think acknowledging and respecting that heterogeneity within communities is really crucial for meaningful engagement and collaboration. Getting to know your community partners and understanding who they are is so vital to really building and maintaining those relationships long term. And I was thinking about this today. I'm not from the GTA, but I've been here for a while now, and I really understand what a faux pas it is to refer to someone from Brantford as being from Hamilton, or someone that's from Brampton as being from Mississauga. And it's the same with the prairies. To the outsider, it may seem like someone from Regina is the same as someone from Winnipeg, but there are countless cultural differences between these groups of people, and they have different shared experiences that differ them from one another. So I think understanding these and the history of those cultural experiences really helps to show you understand your community partners and want to honor and celebrate those differences and reflect that in your research. And just making sure that you're really tailoring the methodologies to accommodate for those perspectives. It's going to help ensure more comprehensive and equitable outcomes. And I am going to pass it off to, I believe I actually can't remember who's next, so take it away. Yes, pardon me.
Thanks, Josh. So just some questions that we've answered. Who should be included in the community engagement, in the research, and why? Especially we talked about Indigenous populations, but some other questions we really need to ask ourselves is, what does good engagement look like? And where should the community be involved in the research process? And those are really crucial questions that we're going to answer right now. And it's very different answers, right? You have to think about community engagement as a spectrum, right? You can have lower levels of engagement where they're informing, they're consulting, they might be involved in some steps of the way. And then you can have higher levels of engagement where they're collaborators, they're meaningful partners, or you have them empowered. They're empowered to lead the research process. And historically, it's mostly been in the lower end, right? It's academic led, they're not meaningfully engaged, or it doesn't actually benefit the community in some way. So if you want to really move towards a higher spectrum, you really have to put community at the core principle of the research, right? You have to think about them leading the co-creation. You have to think about their identities. You have to think about all those questions, right? And who benefits, and they have to have a benefit. And there's very different ways you can do that, right? You might know about youth participatory action research. You might know about community-based research, especially Indigenous populations. But one implementation part that I want to talk about is the community-based participatory research, or CBPR. So next slide. So this is one way you can do community engagement. It's towards a higher end of the spectrum, right? And it posits that you should engage community partners in the whole process of the research, from defining the research question to the dissemination of the results, and even beyond when you're doing action planning. And there's a lot of principles that we can listen to, and then can kind of guide us in this process. And some of them are repetitive, but we've seen, thinking about the community as a unit of identity, as the experts, having those co-learning, capacity building opportunities, thinking of sustainability, this commitment to continue, this really cyclical iterative process as well, to make sure that it's not top down, that you have check-ins built in the process to make sure that it's reflective of the community needs and the realities. And finally, this addressing race, ethnicity, racism, social class, and humility questions as well is really important in this approach. So that's in theory. What about in practice? So this is some preliminary results from a study that it's still ongoing, and we've conducted it in the past year or so. And it's really listening to the experiences of the researchers and community partners who have conducted this type of CBPR research in any type of pediatric study during a COVID-19 pandemic. So just listening to some successes, what we're hearing about is, first of all, humility. There's some really great researchers out there that are taking off their researcher cap and just getting to know the community as human beings. And that's really great in building trust. Also, community being valued as true experts of their health, and including those community voices and those lived experiences in the whole research process. Might think of representation and study design and the participants. Also, the mutual benefit, right? You want to make sure that there's mutual benefit. And some studies have a real positive impact on community, even in a pandemic setting, which is really great to hear. This equitable partnership process as well. You might think it's not realistic to involve them in the whole process, but it's been done, and it's been done well. having this community advisory board as well, just checking in, making sure that the study design, everything is really up to par to the community needs and the realities, and having the community really lead some steps of the process. You might think of data collection, you might think of study design, really valuable to hear about that. And finally, co-learning, right? Community learning those research skills that they can apply even in their real lives or in their organizations and even in future jobs. And the researchers also learning from the community, from their experiences and their leadership is really great. But there's also some real challenges, and you have to think about that when you're trying to implement CVPR, especially in a pandemic setting. Think about sustainability, right? Pandemic is everything shifted. There's a lot of uncertainty. And if you can't promise that you're going to keep the partnership going, if there's lack of funding or if there's lack of commitment from the research institution. This cyclical and iterative process is also sometimes difficult to implement. If you don't have any evaluation built in the study to just make sure everything is up to par, that can be really difficult. And this empowering and equitable partnership can be challenging. We're talked about power dynamics between researchers and community partners, especially if the community feels that they don't have anything to give because they don't have any research experience, so that can create barriers. And doing everything on Zoom, online, because of a COVID pandemic, really increases the power differentials. It's really difficult to build trust when you're doing it over a screen. Sometimes also just taking account that CVPR takes a long time. You really have to do it meaningfully well. It takes some time. And a pandemic setting is not ideal for that, where everything is rushed and you have to produce results really fast. And finally, just realizing that community is busy, right? They have their own realities, their own jobs, their own roles in their community organizations sometimes, and you're asking to involve them meaningfully in a whole process that can take more than years and years. So it's really difficult to do that sometimes, especially in a pandemic setting, and you have to take account of that. So just moving it along, passing it to Shazeen.
Thank you so much, Marianne. And Ramadan Mubarak to any of my colleagues who are also celebrating. Thank you for joining us during this time. I am really excited to extend this now to say, how do we engage families who are the ones with lived experiences? My area of work comes from working with families who are new to Canada, which I recognize as a broad umbrella term, but includes immigrant families, includes refugee families, includes families who are also undocumented. When I worked, prior to moving to Stanford, I worked in Toronto where I created a clinic to support newcomer families. And I found all the time I kept hearing about growth concerns, but there's very limited evidence to tell us how to support them. And so this project came from saying, well, if we want to do a study to look at growth outcomes in newcomer children, we need to do that collaboratively. And I hope this is an example of CVPR in practice. I do want to highlight two of our partners on here, which are two refugee centers, three refugee centers that you see here, in addition to our healthcare practice. So next slide, please. And this study has been designed from start to finish with parents who themselves are new to Canada. We have families we have 7 parents. All of them have arrived in the last 5 years. They speak 3 to 4 different languages. Some have children with special needs. And from the very beginning, they said, well, first we need to understand why families can't participate in research and come up with guidelines to support researchers, as well as help families understand. This is an example of what our community advisory board meeting will look like. Our parents said they wanted to meet online for a few of the meetings. And what is really amazing to see when you're working with community advisory boards is that that board can actually create a community of its own. The parents now support each other, and we're planning to have a social event where everyone's going to come with their kids so that we can still keep building together. So far, on the next slide, what we have done is we have done over 30 interviews, and I'm really excited to share with you some of the preliminary themes that you might hear as echoes from some of the other presentations that have been amazing today. What we've heard is that trust is really important to parents and families, particularly those who are new to Canada. Who is doing the research matters. One parent even said that if I saw that a research institution, a research project had the logo of a hospital where I had had bad care, I wouldn't want to participate. Why would I want to help them if they couldn't help me? And some of us as clinicians and researchers don't see how our identity is actually seen as a whole to families outside of our institution. What we also heard is where the research done matters. Research that is flexible, that allows families to participate where they're already going is important. What they're asked to do really matters. We heard diversity of experience that some families said, I'd be okay doing a questionnaire and an interview. I might not let my children do a blood test or an x-ray, but some said yes. And what really helped make that is understanding why the project is being done. I think many of us as researchers believe that we're really explaining this well when we're trying to do recruitment. But what was very humbling from this project is that maybe we're not. And what families really wanted to hear is, how is this going to help me? Or how is this going to be helping others? I want that to be very clear. What humbled me the most is that every single parent who we spoke to said they wanted to participate in research. They wanted to give back. But what was important to them is understanding the results of the project. This should be delivered to them directly in a very human way, either through a meeting with food where they could hear about the results of the study, or in a flyer, and that translation was important. And lastly, compensation or recognition for their time and labor was important, but what that was differed. It wasn't necessarily a large amount. It could be something like a gift card to a grocery store, or even a toy for their child, something that showed acknowledgement of their work. Next slide. But what I was struck by is that as the clinical and community providers we spoke to, we may actually be making assumptions about the community that we're serving and their level of engagement, highlighting for me the importance of really speaking to the very people that we want to build interventions with in our work. As we heard, trust is an essential component of research that's facilitated by all these factors: where it's being done, the language that's being spoken, the positionality of the person who's engaging in the research, and the warmth and attitude of the researchers. But what I heard was that providers are protective. They often hear about research studies and make decisions about whether to present it to their families and clients that they work if they perceive it doesn't add up to their measures of trust. And I also admit that I am totally guilty of this as well. But I wonder if what we heard is that this gatekeeping then may result from the perception that families new to Canada don't want to participate in research because of competing demands, which, as I said, was completely different from what we heard from families. Families wanted to participate. What providers thought was acceptable to families was really different from what we heard from the families themselves. And most importantly, providers didn't feel that compensation was required, but all the parents felt that some compensation was important. And I hope this highlights an example for you of what engagement can look like with a group of people who are often left out of research studies. And I'm really excited to share this project and the results on, which will be the results will be given directly back to the families who have participated, as well as the refugee centers. So I'm excited to pass on the baton to Patty, I think.
Sorry. Yes, thank you. And so for maybe 1 or 2 minutes, I'm going to share with you some of our experience with the Popcorn platform, which, as we mentioned, is a CIHR-funded study that brought together all the pediatric hospitals and a bunch of the networks that you see here on the left, the research networks. And our overarching goal was to create a research infrastructure to study COVID, as well as have a hospital-based platform that would be research ready for any future health threats. We have cross-cutting pillars that include methods, data, and biobanking. And as well, at the bottom, you see here, we have our equity, diversity, inclusion, and indigeneity team and the patient engagement team that participate in all aspects of the platform, including having formal youth and parent representation on the scientific and governance committees. So these were the overarching kind of objectives that we had embarked on initially in collaboration with our patient engagement team. Vivian will elaborate later on the research team anti-oppression training in subsequent slides. So our team aimed to engage parent and youth partners throughout from the beginning, where parent partners had participated in the original grant proposal, and we had others participate in the review of questionnaires, data governance and access policies, and moving ahead into our analysis and interpretation and knowledge mobilization, we'll continue to engage. And here I wanted to just highlight very quickly, some of the challenges, the real challenges and solutions that research teams such as ourselves have. Although we strive to ensure to create a research platform for COVID that would not further widen health disparities, we also are realistic about who we were actually able to engage and represent in the project as partners. Our project was conducted across Canada, and so it involves actually a widespread and heterogeneous community. So we couldn't authentically engage with and ensure representation of every single diverse intersectional communities that may exist in the 16 pediatric hospitals. Further, the parent and youth partners who are working with us are a subset of these communities who have a certain capacity to do so, whether it be time or cognitive bandwidth or motivation and interest. So we have attempted to address these challenges by leveraging on some of our diverse research teams, kind of existing relationships with existing partners and communities, and as well as having an Indigenous Advisory Council to oversee our project activities. Another challenge we wanted to highlight is how a study such as ours, that includes so many communities, can truly implement principles and frameworks that protect data of health equity deserving groups, and how we can really ensure that data is appropriately used to promote health equity. And when I talk about frameworks, I'm referring to these. So we've got the fair care principles as well as the OCAP and EGAP governance principles that I'm going to skip over a little bit here, that provide guidance on how data should be collected, managed, analyzed, and used. And despite including these frameworks in our written policies, ultimately, the data is housed within our institutional walls and systems. We have institutional policies that are enforced kind of in the name of data privacy and security. So we could further debate and reflect on who truly owns the data. Nonetheless, our team is committed to upholding these principles and frameworks within these institutional policies. And I do emphasize that it takes a team and it takes leadership that supports a team to do this. Vivian.
Great. Thank you so much, Patty. And just want to say, really witnessing the brilliance, the care, the empathy that is expressed by my team members in this work really reminds me to say that, a core part of the work that we do is finding people that you trust and can build that support network with. EDI work is so challenging and it can be so draining. And, all of this, learning from my coworkers, learning from all of you on this call is what makes this work worth it. So anyways, I just wanted to talk a little bit about the work that we've been doing to provide resources and education to researchers. So we've acknowledged essentially that EDI or DEI training exists in many institutions with really the best intentions. However, not all, but some of these trainings are often generic and not really interactive, and they do not offer knowledge on how to actually put these principles in practice. Moreover, we've seen that health equity training often doesn't address all the core principles and practices of anti-oppression, anti-racism, cultural safety, and other concepts that actually require us and challenge us to critically think about our own roles in reinforcing systems of inequity in our work. We also see that this training is often now used as a checkbox activity and a performative gesture that isn't accompanied by meaningful action at the institutional level. So we as a team co-developed the principles of belonging in pediatric care and research workshop. And I love that belonging came up as this key word for community in our collective definitions of it, because it really is about belonging for us too. And we're developing this training with the hopes of addressing some of these gaps to the best of our efforts. And we acknowledge that we have a long way to go and are learning so much more ourselves. So we designed this training to prompt researchers, including ourselves, to critically think about the research that we're doing with communities. And in these workshops, we're not positioning ourselves as experts or teachers of equity, but rather co-learners with the opportunity to facilitate discussion and reflection with our participants. And now we've actually received a lot of requests from research institutions, networks, and universities across Canada and the United States. And the Principles of Belonging workshop has really grew and expanded so organically in response to the requests that we've received through our personal and professional networks, which to us really demonstrates the need for this kind of anti-oppression training and health research. Next slide, please. So in this table, we have outlined the major sections or themes of our training, which we really tailor to each specific context or organization that we deliver to. So we begin with some of the fundamental principles and practices of, analyzing the structural determinants of health and intersectionality theory. We're really trying to understand health equity through systems and structures of oppression. So really asking ourselves, what are the root causes of the observed health disparities in our communities? And this always allows us to trace back to colonialism and systemic racism. A key component of all of our training is also the self-reflexive and interactive exercises and case studies. And we aim to have at least half of this time in our workshops to be dedicated to discussion. And the first exercise that we pose prompts participants to reflect on our personal and institutional positionalities. And then we have case studies that are, again, really tailored to the working context and co-developed with the organizations that we're delivering these workshops to. And this aims to provide opportunities and spaces for participants to engage in critical dialogue with each other and to put these principles in practice within the context of their work. So ultimately, we're really hoping that these conversations on these case studies serve as a starting point for further work to be done within their organizations. But with all that being said, we are continuously learning and continue to encounter significant challenges in ensuring that we're also applying the principles that we advocate for. So we want to ensure that our impact is sustainable and that our workshops are not also becoming this one-step checkbox activity. We also acknowledge that co-development takes a lot of time and investment from all the parties involved. We're also finding that evaluations are a little bit challenging just due to low response rates, and we're not really sure at this time about how exactly we want to measure the specific impact that we're hoping to make. So, for example, how do you really measure increased capacity in health equity practices, or how do you measure institutional change? So we're open to discussion about any of those challenges that we're currently facing. Next slide, please. And here we wanted to offer an example of how we have engaged with and co-developed training with a partner organization. And this is the Translating Emergency Network for Kids, or TREC, which is a not-for-profit network focused on knowledge mobilization for pediatric emergency care. They do amazing work, also a lot of co-development with communities as well. So feel free to check out their website. So they had reached out to us after attending the Principles of Belonging workshop that we delivered to Popcorn, and they had this realization that their team also needed a similar training. So over the course of a few months, we met with the TREC team to co-develop a workshop tailored to their knowledge mobilization activities, and we also conducted a team-wide needs assessment for EDI training in TREC to inform the content that we're developing as well. So we ended up delivering the workshop in January this year, which was really well received. And we actually just followed up with TREC to discuss their feedback for us and any future opportunities for additional training at multiple levels of their organization. Next slide, please. So in terms of evaluations and other feedback we received, as mentioned, we had experienced some challenge with response rates, but these are some of the preliminary results that we had received. So a high proportion of participants, so specifically 42%, believed that the workshop really provided new knowledge on equity and anti-oppression concepts, and that was people who strongly agreed. And we even saw a higher percentage, so about 58% had strongly agreed that the content was relevant to their work. Next slide, please. We also included a question that asked whether participants felt prepared applying the concepts and practices that were presented during the workshop. And we saw that 42% of participants strongly agreed and 47% agreed with the statement. And finally, we posed an open-ended question for individuals to offer feedback on other areas that they found to be particularly useful. So we saw, again, that breakout room discussions with case studies were really useful, content that was tailored and applied, those self-reflexive exercises that we did as a collective group. And I really like this quote about seeing a community of practice forming around how to implement principles of belonging in research. And I very much see this space also as a community of practice as we're learning from and with each other. And finally, we wanted to take a moment to reflect on the power and privilege that we hold as researchers and practitioners in this space. So as we know, research and academic institutions are in and of themselves sites of knowledge production that privilege certain worldviews and perspectives while systemically excluding others. And these broader systemic contexts shape who is part of an institution and who is not. So we can think a little bit about, the relative presence and absence of underrepresented and excluded groups, even on this call and at this event. It is critical for us as clinicians and researchers to consider the privileges that we hold as members of research and academic institutions working in child health and pediatrics. And our social, historical, political locations within these institutions actually influence how we produce knowledge and what kinds of knowledge that we generate. As researchers, we benefit from the systems that we are embedded within. And these privileges are not intended to make us feel guilty or negate other important parts of our identities, but we must recognize that we have a responsibility collectively as academics, researchers, and clinicians to share this power and champion excluded voices and perspectives in our work. So we wanted to end with this quote. Next slide, please. And it is by Lilla Watson, who is an Indigenous activist in Australia. And she says, "If you are coming to help me, you are wasting your time. But if you are coming because your liberation is bound up with mine, then let us work together." And thank you all so much. Feel free to reach out to us if you have any questions or want some follow-up discussions. And I'm aware that we have some questions in the chat as well. All right, so I think the first one that we had received was from Victoria. And Victoria says, if you have limited resources to include or remunerate members of specific communities in the research process, do you have suggestions for how teams can meaningfully gather insight from populations with which they are personally don't have shared lived experiences with? I would love to have the capacity to approach this work with all of these best practices, but sometimes it isn't possible. So for example, from a provincial health organization perspective. So I wanted to open the floor to my team and see if anyone has any answers for that, and we can popcorn style.
Popcorn style. It's interesting. This is a conversation we've just had recently, and we struggle with this ourselves, and it's especially when we're talking about really broad research, sort of like I guess even geographic areas, because for instance, with Popcorn, as Patty said, with our sites across Canada, there are going to be countless communities represented, and it's really hard to get the engagement of every single one of them. So exactly what you just said. One thing that came to mind was looking if there are any sort of like maybe membership coalitions that might represent the community that you're hoping to engage with. One thing that specifically comes to mind, and this is very Ontario specific and Indigenous specific, but the Indigenous Primary Healthcare Council. Now they've got a number of member organizations that themselves represent a broad number of Indigenous communities. Now, of course, this isn't getting direct community engagement, but in that case, at least you might have representation from someone that themselves represents the voices of those community members. That's about the closest that I've come when I've thought about this question myself. I don't know if anyone else on my team has anything else.
I think that's great suggestions. I also think looking for member coalitions is great. And I wanted to kind of, my thought was looking into the thought about the question around remuneration. And I think there's many ways you can provide compensation, right? So being open with the community membership organization or community partner and saying maybe they really want to have a physician come and give a talk around child development. Maybe they really want a list of resources that they can provide for their parents. Maybe it's, just knowing how they can expedite getting a referral into your clinic. There are lots of ways, I think, in which we can contribute value that are beyond compensation. And it can start from just asking the community partners you want to work with and coming with an open conversation. I really find that very helpful. And it's amazing to me. Money isn't everything, and that there's a lot of things that are just as valuable as money, but we don't even sometimes see the value in what we ourselves can bring. So I hope that answers your question, because I think coming from a provincial authority, I could imagine community partners, especially local agencies, might be delighted to hear from you and say maybe the next step is building a partnership, so that way we can have a point person to ask questions about. Just some ideas from the remuneration perspective.
And I just wanted to build on that. I think it's just important. I think communities also know we are part of institutions that are also constrained. And many of us who are doing community work, our funding is often subpar compared to, basic science, research, and so forth. And I think being vulnerable with the community and be like, this work is important, if we collectively to do it together, but we're constrained by both systems that we're part of, right? That doesn't enable us to get, money to be able to, really compensate community members. Because at the end of the day, they're providing a lot of emotional labor and time. A lot of this work is very trauma driven as well, unfortunately. But when you have these conversations, as Shazeen talked about, and Josh, it opens a dialogue of vulnerability. And I think there are other creative ways to honor their work and really enabling that to come from them. And I think often there are people who are community members that just want to put tangible outcomes on their CV or resume as a result of participating. And so I have personally had community members be co-authors on publications. I have provided references for employment opportunities. I've mentored their children who want to go into university, who are looking for opportunities to volunteer or, be paid as research assistants, and so forth. So money isn't everything. I think that's the goal of human life. But again, really having those open and transparent conversations.
It's
And
interesting, Ananya, as you were saying that, Kat offered some of this as a very similar sort of suggestion as well, like providing the references, and again, someone said authorship as well, job references and volunteer hours.
If I may, just one last point. I think because I had worked previously in a federal government context, I very much sympathize with you and, the structural barriers of actually reaching out to communities and doing that on the ground work. I think it's important also as people within these organizations to advocate for systems change and to advocate to the leadership to say we need to have money, allocated to community engagement, meaningful community engagement and partnership. And we need to ourselves do the work within our institutions to create the spaces and the opportunities for that kind of safe engagement. So I think, very much echoing all of the things that my team members have said, but I think it's also important for us as people working within these institutions to acknowledge those gaps and work towards filling them. Okay, great. I'm seeing some other questions that had come into the chat, and I'm unsure if we still wanted to answer them verbally, given that there was a lot of chat discussion going on. There was a question about, when working with certain newcomer populations, we find that sometimes they're quite confused when asked about sex at birth of their child. Is there a recommended culturally safe approach for this?
I think Samira answered it beautifully in the chat. Recognizing not all newcomer populations are monolithic, and even within people coming from one country of origin. There's diversity of culture, there's diversity of language. So really it's helpful to have that representation on your team so you can know how to best ask questions. And I think Patty and I on a project where we're co-designing a navigation program for families new to Canada, we've gone through the questions line by line, and it's exactly that, where we've changed how we're going to ask the questions with our parent advisory board, who all have diverse experiences, and that's made it much stronger. So I can't give you like a one-size-fits-all answer, but I think Samir said it most beautifully.
Thank you so much. And I'm cognizant of time and just wanted to acknowledge Kira's comment about sharing resources. I'm seeing that my team members have popped in a bunch below, but feel free to reach out to any of us for more information. Thank you all so much.
Thank you all, Ananya, Patricia, Vivian, Marianne, Shazeen, and Josh, for this great presentation. You can see from the chat box that folks are very engaged and very appreciative of you sharing your time and talent here today. Some themes that emerged for me through the discussions were diversity, even among diverse communities. No group is a monolith, and representation therefore matters. Your community may be represented by somebody, but that somebody needs to bring to the research team an understanding of the diversity of the community that they're working with. Humility, particularly cultural humility, but humility and lifelong learning, and acknowledge that we're all sharing with and learning from each other. The lack of training in health equity and the importance of doing more of this kind of work. The concept of health equity tourism, which was a new term for me, and how it can impact the mistrust between academics or researchers and the communities they serve. Respecting of community expertise and empowering community members through support, as well as potential employment and training and further capacity development. The importance of trust between and among researchers and with the communities they serve, as well as establishing trust with the families and the children that we're serving through this research. Community-based participatory action research, and the lack of funding, sort of what I'm hearing is the poor sister to some other levels of research, and how we might need some research advocacy to increase the funding and help research funders understand the complexity of this work and the importance of the early investment in relationship development long before you actually ask a research question. And that kind of work is essential but undervalued in, I think, a funding. You don't have a deliverable per se that comes at the end of it, and therefore it may not be as valued, but it's essential to good research in this area. Co-design, co-implementation, co-knowledge mobilization, and our collective responsibility as researchers, academics, folks in the child health world to leverage our power, champion our communities, and be inclusive of the diverse voices in our work. We'll now take a break. Again, I want to thank you so much. While you're on your break, there'll be a few slides going by. Feel free to stretch your legs, get a new coffee, have a glass of water, and we'll meet you back here at 2.